Good afternoon, everyone, and welcome to the Thursday, September 26th meeting of the Strategic Priorities, Communications, and Intergovernmental Cooperation Committee. Call to order. Are there any declarations or conflict of interest? Seeing none, can I get an approval of the agenda? Moved by Councillor McKinnon, seconded by Deputy Mayor Yankoff. All those in favor? All good? All right. Minutes from our August 22nd, 24th meeting. Can motion to approve those? Moved by Councillor McKinnon, seconded by Deputy Mayor Yankoff. I guess no business arising. Anything coming out of that? All good? All right. So we have a few items up here for today. The first one is a notice of motion that came from Councillor Tweel, who's with us as we invited him here today to come in and speak to his notice of motion. So thank you for coming in, Councillor Tweel, and gracing us with your presence, I guess, here today. So maybe we'll start with that, and maybe we'll allow you to speak to it, Councillor Tweel, and you can. We have the report in our file, and you can speak to it as to any additional information that you would like to add, or speak to the report itself.
Well, thank you, Chairman Beck, for the opportunity to come here before the Strategic Priorities, Communications, and Intergovernmental Affairs Cooperations Committee. I file this notice of motion. The motivation being proactive and looking to facilitate a major challenge in our city that's been taking place in recent years. So what I'll do is I'll get into the specifics. A notice of motion to support rehabilitation and treatment for hardcore drug usage. That the city support rehabilitation and treatment for hardcore drug usage. The motion reads as follows. The Charlottetown City Council supports rehabilitation and treatment for hardcore drug usage like heroin, fentanyl, crystal meth, cocaine, and other substances. These professional services would be provided by medical professionals, such as physicians, doctors, and other professionals with the undeniable credentials, qualifications, medical expertise, and experience to help with addictions, to transition from hardcore drug usage to professional development and recovery. This transformation would also include detox beds and other indispensable services that would help with the integrated programs, procedures, and processes that do not include and is totally and completely contrary to drug usage, drug paraphernalia, and drug injection sites. Moreover, the Council lobbied the provincial and federal government to provide these imperative and essential facilities and services consisting of treatment and rehabilitation, which would be provided and administered by doctors and qualified medical practitioners with the education, qualifications, proper medical expertise. So, Chairman Beck and members of the committee, I believe that Prince Edward Island is lacking in these facilities. I believe that the city of Charlottetown has been experiencing some of the residents that are addicted, that need help. And I believe that this is a major step forward. We're starting to see this progression across Canada. Number of cities, provinces are moving in this direction. And I believe the city of Charlottetown would be very proactive, very productive in lobbying both levels of government to provide these services to help the folks that are dealing with these addictions, to give them the proper medical expertise and help them with the programming that's truly required for that transition to actually take place. We need these facilities here in our city and in our province. I've talked to many, many islanders over the last year and a half, hundreds. And this is what people are talking about, and this is what they're recommending. And this is what I've heard consistently over and over and over again. And I wanted to bring the notice of motion to council, to this committee. I'm optimistic that this committee will make this recommendation to City Council, and then Council will pass a resolution and forward on to the province and the federal government to provide these facilities to help these people. Because what we have right now, to my mind, is not working. It's just not working. Drug usage is rampant in our city. Oh, those are undisputable facts. And why do we have to stay with, to my mind, a program and in most minds of many people that live in this city that is simply not working? And why not be proactive and put in the proper facilities when it comes to rehabilitation and when it comes to treatment? This is something that that many people in this city would like to see, and many people in this province would like to see. So, Councillor Beck, there's obviously different models across the country, but I think this is a major step in the right direction, and I'd like us to to work with both the provincial and federal governments and to lobby hard for these facilities and these services. Thank you.
Thank you, Councillor Twill. I'll open the floor to any comments from the committee members. Councillor McKinnon, you have your light on? Go ahead.
Thank you, Mr. Chair. I'll agree with you, Councillor Twill, that what we have right now is not working. I think it's failing in many aspects, but question, do you know, is there a service at the outreach center? I've heard rumors that there is a service there. I'm not saying that it's working or it's not working, but is it something that's there that could be tapped into, moved, worked upon to improve? Have you heard anything about that?
Councillor McKinnon, I've heard similar rumors. I don't think anything is really, I don't think there's any reality to it. I hear different rumors, but as I said in my notice of motion, we need a facility with the proper amenities, the proper amenities and medical practitioners, like trained physicians, doctors, people that have the expertise in this field to work with these individuals and to help them through that progression, the different phases and the different programs, and then once they feel that they're ready and complete that program, then they become integrated back into our community and make a successful contribution, which I know that they have the potential to do. But as far as what's happening down in Park Street, I don't believe certainly we as a council didn't approve anything to that effect. I understand that there was supposed to be absolutely no drug usage in that compound, whether it's the emergency shelter or whether it's the outreach center. I know I've talked to the minister, and the minister was adamant that there was to be no drug usage in that compound.
Thank you, Chair. I just noticed that further down in our package, there's reports from Carleen Donnelly included in here on enhancing systems of care support, task force terms of reference. So there's kind of aligns a lot with what Councillor Tweel was talking about today, a little bit, I guess. And I'm just more curious about, although it's a great notice of motion, is this in our wheelhouse? Is this something we can do? If somebody could explain to ensure that when we support this, that we're not just, is there really anything that we can do? So if anyone, I don't know, maybe Chair, you could explain it, or Eleanor could explain it, just to ensure that we're going down the right path.
I'll give it a rip, and if there's anything else that, you are correct, Deputy, that this whole continuum of care is falls under the provincial social services, and that's part of their plan. In this report that Carleen Donnelly, I think there's two things that are referenced that speak to what you're kind of talking about that came through in her report. And one is the complex care pilot, like looking to develop something Charlottetown-based that could in turn be developed, piloted, created, and be scaled right across the province for the future. So that's on, I think, page 9 of this report. On page 15, it also talks about, if I can find it here, it talks about the revisiting under the recommendations for the next 6 months, revisiting addiction support access. Consider what existing and new harm reduction approaches could complement abstinence-based in-center models. So it's basically taking a review and looking at the services that are provided and saying, is there a different way of doing it? And I think those are kind of tied in with the critical care model that they're looking to put in place. So I think what we can do to answer the deputy's question is we can look at the report and support the recommendations that are within there, because I think what you're asking for, Councillor Tweel, is being captured in here in this report over the next 6 months, if I'm reading the report correctly. So it's not denying that there is an issue that has to be dealt with, but is there a way that works well in Charlottetown that can be developed? Can we improve the pathways to access, to getting people the proper supports that they need within I forget the term that she used on page 9, complex care center as a model. So that's kind of what the recommendation is that came from that. So with the task force that is being created, that is going to be overseeing this work, that is the way I think that they are going to try and address the addiction question that you're referencing here today as part of that overall broad scope initiative. But ultimately, the service is a provincial responsibility. And we can certainly encourage a certain direction or support a certain direction, but it's up to the province to deliver on those facets there. So that's kind of the way I see it. Eleanor, if you had anything else that you want to add, or Mayor Brown, if there's anything that I might be missing, or if anything that you wanted to say to that, Councillor Tweel.
As long as the model is consistent with what's happening across the country, and I guess I'll have to be very specific, the type of care, treatment, and rehabilitation does not include the continuation of drug usage. It's moving away from drug paraphernalia, needles and crack pipes, and that model or that ideology or that philosophy. The philosophy I'm talking about is totally different, where drug usage is not permitted. That's what I'm talking about. I'm talking about truly rehabilitation and treatment, and expanding upon that. And you know, you're correct. It's a provincial, federal government matter. But the bottom line is it's affecting our constituents. It affects not only the folks that unfortunately that are in this position, but it's affecting the neighborhoods and communities. I received another phone call this morning, you know, where drug use is taking place in her neighborhood. And, you know, she's fearful, she's scared, she's wondering why this is happening, and, you know, like, what's the answer? Well, I believe this is a good option. I really do. I'm doing a lot of reading and following what's happening in British Columbia, Ontario. You know, some major steps have been taken here recently. Policy statements, major dollars committed to facilities and programs of this magnitude. So I want our folks to have the same opportunities and the same options. And you know, I'd like to move in that direction. Let's try this philosophy, this approach, as opposed to what's been happening in the last 2 or 3 years, because it's been very troublesome for everyone. For everyone. Thank you.
Okay, thank you, Councillor Twill. Your Worship, any comments?
I don't know if some of the staff want to participate, that's what we're waiting for.
Essentially, from the staff's perspective, there's nothing to add here. This notice of motion is asking council to take a position on something, a philosophy in how you address drug use in a community. So that essentially is up to council, whether you want to take that kind of position and then lobby the government for that position, which would include writing letters and maybe showing up at the task force pushing that agenda. So essentially, you know, this comes down to a council decision on the philosophy of how you address addiction in the community.
But that's not our area. We're not into that.
That is, like, it's not for the city to provide these services, but politically, it's up to council. If they decided to take that position, they could lobby the province and say that they don't agree or they do agree with whatever method is being used as it impacts the city. But yes, this is a political thing that council can decide whether they take the action or not.
Mr. Chair?
Go ahead.
So, Mr. Chair, when you look at the Constitution Act 1982, BNA, health and education are shared responsibilities in the Constitution. So they're at both the provincial and federal level. And yesterday, Eleanor, CAO, Deputy Mayor, and I were at the task force meeting that was organized. It's an initiative through the province to work on mental health issues. And falls within their bailiwick is health is a responsibility of them. But you know what, Councillor Tweel? We're all responsible for the residents in our communities, whether they're at the municipal, provincial, federal level. So when we start crossing into those responsibilities that are provincial and federal, then we have to take ownership, which means we have to put money on the table. No. You, like, everybody thinks, like, you know, when you become part of the fold, there's no money. No, you have to put skin on the table. And I just want to refer to Schedule A, which is an agreement. This is a public document between the city.
What page is that, Your Worship?
This is not in your document. It's a contract we've signed with the province and Charlottetown Police Services to provide, as it says, 2 police officers to work with the mental health mobile clinic. And it has responsibilities of the province and the city working together on addressing this issue. and it's for a 3-year program. It's a 3-year program. And just remember, as we were told yesterday, Eleanor was there and so was the deputy mayor, when the province looks at mental health issues, drug addiction, crisis, they have to look through a provincial lens. It's not just about Charlottetown. It's Summerside, it's Three Rivers, it's Alberton, it's Surrey. So we have to share that, that there's, it's not just about us, it's about the whole island. So, look, I think that going forward, we can acknowledge this notice of motion, but in terms of getting involved means putting money on we'll have to put funding on the table. And Councillor Tweedle knows, Councillor McKinnon knows, Councillor Beck knows, all of council knows, our primary responsibilities, police services, fire services, public works, water, wastewater, planning, development, heritage, economic development. Those are the services we're responsible for. And we're finding it difficult to keep up with those costs. And an interesting point that was made by the deputy yesterday, who attended the Timmins conference, Timmins Ontario conference, and I'm going to ask her to repeat it, but she took something to the table yesterday that was, I think, well received. And I think that's what municipalities across the country, small and medium, are facing. We're getting, everything's flowing down to us. We're taking the responsibility. But in terms of constitutional responsibilities, it's a federal, provincial, shared responsibility. And I think that we have to work with our provincial partners, we have to work with our federal partners, and one way to do that, I think as you mentioned, Councillor Beck, or maybe our CAO, there is a task force. And they are putting together a community action committee that will be looking at not just Park Street.
For a year.
It's a start.
And we'll review at the end of the year.
That's right, but it's a start, and they want to put that in place, and that was the discussion yesterday. So if I can just defer to the deputy, what did you take from that Timmins meeting? What was sort of other municipalities agreeing to as a group of small and medium-sized municipalities?
Sure, and through the chair to his worship. One of the biggest takeaways from the Timmins summit was, first off, it was a group of like-minded and similar-sized municipalities coming together to discuss these same issues that we're discussing here today. And one of the biggest takeaways was the responsibility that seems to have dropped down into the municipalities because all of these services are happening in the capital cities or in the cities, whereas we don't have the fiscal power to support them, when it comes to cleanup of our parks and et cetera, et cetera, et cetera, our over-resourced police services. And so one of the things that we talked about was that the directive from the federal government is that we will not be prosecuting small open-air drug use. But what also was reminded was that might be the case, but that what goes with that is that they might not prosecute, but it's still the responsibilities of the police forces to at least take a different step. But the issue, as they've discovered, is that there's no resources for them to take these other steps, whether they're understaffed, under resources. So one of the things was similar to what we did here, signing on to the resolution from the Federation of Canadian Municipalities to continue to lobby the federal government for more fiscal resources so that if we are going to have more of a skin in the game, for lack of a better term, and we do have that seat at the table, we don't have everything that we want to put on the table costs us money, which will take away from the services that we're already providing. So that was a huge takeaway from that, and there is a report coming from that summit that I'll be able to share with council as soon as I receive it.
And, Mr. Chair, just to follow up, the Atlantic Summer Institute, that is here every summer, has been here for the last 20 years. Their focus this year was on public health and our vulnerable, complex population. So they would like to come into this standing committee and make a presentation on where they want to work with the city. But Councillor Tweel, I want to say this. I appreciate that you keep this flame burning, because you know what? Lots of municipalities are just trying to sidestep it. They're just saying, look, it's happening, we're going to put the blinders on. And I've said over and over at many meetings, we are keeping the discussion in this chamber. We're keeping it alive, and because we want to see something done, just like you do, like all the councillors, myself, staff, we want to see something done. And I think your resolution is part of the process of working forward or going forward in trying to deal with this mental health, these mental health challenges, the drug addiction crisis. And when you say heroin, mescaline, the drugs on the street are the synthetic drugs. It is your Oxycontin, it is your Dilaudid, it is your fentanyl. And those are the drugs that are more prevalent than all the other illegal drugs you mentioned. So, Councillor Tweel, I'm going to respectfully agree that, we want to keep working on this. And the task force, when our meeting yesterday, I think that they might want us to return as members. I know the CAO sits on it. I know that Councillor Beck, but Brad is a member of the committee. He's a full member. But yesterday, I think we were there as invites, and I think they would take us on as members of the table, around the table too. So, look, let's keep moving this, as you'd say, let's keep moving this ball down the field. Let's get the 7 points and the 6 points plus the kick in between the uprights and make it happen. Thank you, Mr. Chair.
Thank you, Your Worship. Councillor Tweel?
Yeah, I think it's great. We've got the task force, and then we're going to have another committee, then we're going to look at other reports. But you know what? The verdict is in. The verdict is in. It's been in for the last 3 years. I don't know how much proof or evidence we need. That's how it affected this community. All you had to do was look at what took place in Houston Street. The open air drug usage. Needles, crack pipes. All over our city parks, school grounds, playgrounds, sports fields, businesses, people's backyards, people's front yards, public spaces, the historic squares. That is all being funded by the province and by the feds. Those particular programs, through NGOs, are being provided by the province and the feds. We don't provide that funding, but unfortunately, we have to clean it up, which is another issue. I can get into that we can talk about that for another hour. I don't know why, we say we don't have any money or any resource. Well, indeed we do. Our staff is involved and are not supposed to be involved. It's not our mandate to go around and doing up these cleanups on a daily basis. But that's not what I'm here about today. What I'm here about is that I believe that we're in a critical situation. Time is of the essence. All I'm asking for is this motion is to be recommended to City Council, and we pass a resolution encouraging the province and the federal government to follow the merits of this notice of motion to open up a facility, make plans to open up a facility with the proper amenities, a state-of-the-art facility, so these people can get the help that they truly deserve. To me, that is being a step in the right direction. That's being progressive. That is being productive, and sending a message out to our community that the city of Charlottetown is least not turning their heads, but dealing with the issue head on. Dealing with it head on and saying to the province and the feds, the direction that you've taken this country, this province, this city in the past several years is not working. It's just not working. We've seen the evidence across Canada. Look at Vancouver. Look at what happened in Kingston, Ontario in the last week or so. Look at all these, Premier Ford, what he's doing. They're spending an enormous amount of dollars. They're bringing in the professionals, and they're saying, this is the direction that we want to go in. And why would we be any different? I'm not asking for the city of Charlottetown to put money into these programs and facilities. All I'm asking for the city of Charlottetown is to effectively lobby the province and the feds. You have a responsibility, whether it's a health act, at the provincial or federal level, provide these important, indispensable services and programs and facilities with the properly trained medical practitioners, doctors, physicians that have the credentials and qualifications. I believe that is the route to go, and I know many islanders feel the same way, whether you live in the city of Charlottetown or you live across the province. So, Councillor Beck, I want to thank you. I want to thank you for giving me the opportunity to come here today. I've talked to many, many people, and many people want the city to at least support that and to pass that message on to the province and the feds. That's all I'm asking for. I want to effectively pass that message on, to articulate it in such a way that the province and the feds say, okay, we see what's happening. This is nothing new. British Columbia, Ontario, New Brunswick, they're all moving in that direction, folks. Thank you.
Mr. Chair, could I just ask for clarification?
Sure.
So in his, I'm looking at the report details. These professional, this is paragraph 2, these professional services would be provided by medical professionals such as physicians, doctors, and other professionals with undeniable credentials, qualifications, and medical expertise and experience to help people with addictions to transition from hardcore drug usage to professional development and recovery. Are those services not in place? That's my first question. Then, the second sentence, this transformation would also include detox beds and other indispensable services that would help with the integrated, I think it's integrated programs, procedures, and processes that do not include and is totally and completely contrary to drug usage, drug paraphernalia, and safe drug injection sites. So, Councillor Tweel, your resolution saying no safe injection sites.
That's correct.
I don't know how you, again, Mr. Chair, that's, I would say let's defer this to council. I just think that you're going to have loggerheads.
Personally, I think we're venturing into the wrong waters here. I think we're going in. We have the province, who's primarily responsible for this, has commissioned Caroline Donnelly. They've created a task force. They've created a working group. They've created a community action committee who are steering the next direction with recommendations over the next 6 months. I don't think Councillor Tweel has seen the report. I don't think the rest of council has seen the report. I think once they see that report and get an understanding of what is in that report, I think a lot of what Councillor Tweel is asking here today is encompassed in that, myself. That's how I interpret it. I may be interpreting it differently than other people, but the whole idea of looking at the whole support services that are available, trying to connect the right pathways, get the vulnerable population into the proper supports. Housing is a critical piece of that. That's identified in there, and under using trauma-informed and understanding the root causes of what's the source of the issues. So it's a complex, multifaceted approach. I think that is going, that's why if you look at the task force, it's got representation from a wide spectrum of people within various government levels. And we are part of that discussion as the city. So although it's not our direct responsibility, it is directly impacting our city. So we do have some seats at the table, and we are part of that ongoing discussion. But personally, I think what I would hope that we would do is to continue to allow that provincial task force to do its job and to follow through on the mandate that they've created. And I think they've got some ideas, I think, that hopefully can address Councillor Tweel's concerns. So that's where I think we should be, but it's up to council to make a decision.
My wish, Mr. Chair, is to defer this until we get a presentation, an overview of the Donnelly report. I'd like to have her here to speak to council, because it would be very informative, would be very, you weren't in Calgary when we went through CUPS, but her process, I know the CAO was there, Councillor McKinnon was there. Their system, it's a system that I think is a model for many other jurisdictions, and I think that, if we can even bring her back in by Google Meet or Zoom. So I'm just going to ask to defer this until we get more information, Mr. Chair.
Okay. Councillor Twill?
Yeah, with all due respect to the person that you're talking about, is she a doctor? Does she have the credentials? Like, is she a doctor, or is she a physician?
30-plus years.
No, but is she a doc? But
No, it's not
but
a
is she?
medical doctor.
So she's worked in the field of addictions in terms of the facilities and programs that I'm talking about.
Yeah.
Oh, really?
Yeah.
Okay.
Yep. Again,
I don't-
Mr. Chair, I know you weren't there, nor were you, Councillor Twill, but the CAO and the deputy, myself, and I think 7 councillors, we were there. She
Right.
took us through the whole system. Can I just finish? There's a dental, they have a dental service.
Right.
6 or 7, no, I'm going to say 3 to 4 studios. They had a professional doctor group,
Right.
headed up by 9 doctors. They had outreach to services in social services, housing. The model is what we need to go. That I think what she's proposing. That's the model that the
That's the
provincial community.
complex care model that she's referring.
What's that?
The complex care model
Yeah,
she's referring
and
to.
that's what she's
in-
talking about for the provincial
So-
community outreach center. And Councillor Tweel, I know you referred to Vancouver, and I know you referred to Toronto, but they tried to arrest away this problem.
No.
No, let me finish. They tried to, and they found out this is not working. It's not working, so we have to find another route. And again, Mr. Chair, I appreciate that Councillor Tweedle keeps this on the top of the agenda, because it should be on the top of the agenda. We should be caring for our vulnerable and unwanted and unwelcome population, but we have to find solutions. And there's the Caroline Donnellys out there. They have a model that's working. Can we use it down here? Yes, we can.
Councillor Beck, I'll say one more before I depart. That's one model. There's other models across this country. And if you look at the recent announcements of the Premier of Ontario, Doug Ford, his model is facilities, rehab. I think we, as a city, whether we want to acknowledge that we have that jurisdiction, no, we don't have the jurisdiction, but we have the responsibility to protect our residents. I really think we have to do our due diligence. I've been following what's been taking place across Canada. And I think, we need to look at those new models that they're referring to. Maybe then we can do a comparative analysis as to what model actually works. I'm not talking about these other things. I'm talking about helping these people with the addictions now. I'm not talking with the continuation of drug paraphernalia and drug usage. That's not what I'm promoting here. I'm promoting no drug usage in these facilities where people with addictions would be able to work with medical practitioners, people with qualifications, and to help them move away from drug usage. Because in a lot of those instances across Canada, it's not working. So I guess it all depends on what program you want to adhere to, or what philosophy you want to adhere to, what model you want to look at. But just following what's been taking place across Canada, there's a trend right across this country, and I don't know why we would be any different. And stand to be corrected, but I think my information is very accurate, and I'd like to look at those models, Councillor Beck or Chairman Beck. I'd like to look at those models, and that's what I'd like to promote and encourage our provincial and federal government to move in that direction. And it's great that we can, have these study groups, working groups, it'll be another 6 months, another year. These people need help now. We need to get the message to the province and federal government now to construct these facilities, bring in the proper assets and apparatus and people that can help these people and get the help that they need now. Let's start moving in that direction now. Time is of the essence. We can't afford to wait another, all due respect to all these committees. The evidence is there now. The evidence-based results are there now. Let's move in that direction now. Thank you.
Councilor, just 1 second. Again, Chairman Beck, it's too bad we were not all out in Calgary. It's too bad we. It's too bad we were not all out for the FCM in Calgary, because the tour that we did with CUPS, and just, it's the Calgary Urban Project Society, that's what CUPS is a success story. And it's being replicated by other communities across the country. Why do you think Caroline Donnelly ended up in Timmins? She was there to talk about her model. And in terms of low barrier at CUPS, there is barriers. There is no drug use. You're in and out. There is no hanging around. It's a facility to get help to individuals that need it. So I'm asking, Mr. Chair, let's defer this issue until we bring in Caroline Donnelly, or bring the report to this chamber, discuss it, go through it, point by point, sentence by sentence, whatever you want to do. But I think that's what we have to, let's get educated. Now, again, we can say, we need to get it done now. We need to get it done now. Well, you know what? This issue has been building over the years. What took it to light was COVID-19. It brought it out onto the streets. You don't think, Councillor Tweel, that drug usage was an issue in this city before COVID-19? It was. You know it was. I know it was. And now it's right in our face. It's in our parks. It's on our streets. And we have federal legislation, federal directives from federal prosecution that if it's not a major drug crime, we're not dealing with it. But the deputy who attended that Timmins conference, we need more resources to deal with it on the street. And we need those resources from the provincial and federal and provincial governments. And that's why when it comes to tax equity and sharing the taxes that the province collects, we need a better deal.
Chair Beck, just one more.
And I had my mic on too.
I just want to allow Eleanor, she was up next, so I'll let her go.
Thank you, Chair. I just want to qualify my comments in saying that this is purely political in terms of council's decision to do this. Because of the wording that's in here, asking council to declare that it doesn't include the methods to help the addicts, doesn't include drug usage, drug paraphernalia, drug injection sites. We don't have anyone on staff to tell you whether those are good or bad methods. We don't have any expertise in that. So when I say it would be council making a purely political call on something like that, it would be, because we have no research or anything to back it up and advise you on that. If council did say approve this motion as it stood, then the request from administration would be for funding to hire a consultant to do this analysis, because nobody on our staff has these skills. Because it's not like we've already talked about, it's not been our role as a municipality to take on these functions. Now, when we go to this task force, the reason why administration is there, it's the fire chief, police chief, and myself. It's not actually to say whether your method of addressing addiction works or not. It's instead to look at whatever is being discussed and put in front of us to say, okay, we're hearing what you're saying, latest scientific technique, whatever you got, research, and we go, okay, here's what we think the impact's going to be on the city. So depending on whatever they're putting on the table. So police would say, okay, if we do this, then we could see possibly these being some of the outcomes. Or fire would have their perspective, or when I'm sitting there, I'll be thinking about parks and public works and the impacts. And that's really our role sitting at that table. We're not sitting there as expertise or experts in addiction or what methods are the right way to go. So by moving forward with a motion like this would be taking us in a direction. And our recommendation further to that would be then, let's find a consultant to do that work and advise you, because no one on staff has the ability to do that right now. Thanks.
Final point, Councillor Twill?
Thank you. Thank you, Chairman Beck. Why, you talk about this other group that's working and they're looking at different models and or strategy. I would suggest that we do this simultaneously. We could still move this resolution forward. The committee can still do their work, but it sends a powerful message to the province and the feds. We've got to start doing things. We need a plan of action. And that plan of action, to my mind, will be consistent with the evidence-based results of what's taking place across Canada. When you see the Premier of British Columbia, Premier of Ontario, Premier Higgs, Ontario's the biggest province of Canada. And look at what's happened in British Columbia. I mean, that went on for decades, and it wasn't working. So that's what's motivated me to bring this forward here, because our residents and our neighborhoods and communities are very troubled. They're scared, there's anxiety, they're fearful, they don't feel safe anymore, and therefore, let's put in the proper facilities, programs to help these people. I think this would get a lot of support from the residents across the city, as well as across the province. Thank you, Councillor Beck.
Councillor Beck, I just have to say this. This is repeated a lot by Councillor Twill. It's unsafe. There's crime everywhere. We have a police force that works day and night to protect this city. And you know what, Councillor Twill? They do a great job. They do a great job. And you know what? To reduce those fares, they're out there on the beat. We're providing a service for Birchwood Junior High school students so that they can walk between Birchwood Junior High and Wendy's restaurant and other facilities on Grafton Street East. That's what we're doing. We're cleaning up our parks, which are our responsibilities. We're taking care of all the needs that are being asked of us. But to keep saying it's an unsafe, a terrifying place to live, that's a false narrative. And I'm tired of listening to how you bring that up constantly in meetings like this, in our council meetings. So, Mr. Chair, I'm going to ask to defer this resolution, and let's move on.
Okay, so motion is on the floor. Just one thing, Councillor Twill. So a motion is on the floor to defer this
Discussion.
discussion
Yeah.
till further information is
From
received.
Caroline Donnelly's
from
report.
Caroline Donnelly's report.
The task force.
For council to
Yeah.
absorb. So is there a seconder for that motion?
Thank you, Chair. I will second that. Getting that information is key. I've been fortunate enough to have a spot at the table periodically to listen. I saw Carlene's tour. I've read her report. I think it would be a really good opportunity for the rest of council to really have an opportunity to not only read the report, but an opportunity to ask her questions. I know she's in the city this week, but I guess it'd be, it's too late for this time, but she'll be back again. And I mean, there's talk, not only in this continuum of care, but there's talk about the brain, and there's this 0 to 18 is what the focus now is with healthcare professionals, is to get to the children, the babies to 18, because that's where your brain is. So, starting that. So there's so much information there for us, I think, to unpack and understand. So I'm not saying no to Councillor Tweel's recommendation and notice of motion. What I'm saying is, let's get all the information and look at this report, and hopefully have an opportunity for Carleen to report to council and give all of councillors an opportunity to be able to really ask her those hard questions. So.
Okay, so the motion is put forth by His Worship and seconded by the deputy, I assume. Councillor McKinnon, any comments? No?
Can I just,
Questions called.
Council Chairman Beck, can I just respond to the mayor there?
Questions called.
Just the question, we're dealing with the motion here, Councillor.
Okay.
So question called, all those in favor?
Yeah.
Okay, 3-0.
Can I just respond to what the mayor said?
Quickly.
Yeah, Mr. Mayor, you might be tired, my residents are tired, and the residents of this community are tired of feeling the way they are. That's exactly the way they feel. I'm bringing their concerns to the council table as accurately and as honestly as I possibly can.
Yep.
So, you might be tired, they are more than tired. No. I bring their concerns.
That's fine.
I bring their
That's fine,
concerns
Councillor.
to the table.
Yep.
That's
Yep.
fine.
Okay,
Yes.
thank you.
Yep.
Thank you.
Thank
All
you,
right.
Mr.
Chair.
Thank you, Norman.
Thank you, Councillor Tweel. Thank you for coming in. Thank you for your care and your concern.
Chair. So from here, this means that the minutes will go on to council of this discussion that we had today, but there's no action on this report yet because we've deferred it. Is that correct?
Basically, he's filed the motion. We're not doing anything with the motion. We're waiting for council to have the opportunity to receive the report that we're going to be talking about here shortly, and have everyone the opportunity to see it. And then if any decision is to be made at that time, then council will make it at that time.
Chair?
Yeah.
So because of the way that procedural bylaw is written, the notice of motion has to come back to council. Like, he's made the motion, but what the recommendation from committee will be is that it be deferred.
Right.
And then council will just agree. So it will go, it's not going to stop here. It will go to council.
Deferred pending until the other information is received, correct?
Yeah, or until presentation from Carleen Donnelly.
Carleen
if-
comes in, yeah. Okay.
Yeah.
All right. Sure, go ahead, Deputy.
So then if we're referring to the procedural bylaw, and it has to go back to council with committee's recommendation, I'm pretty sure our procedural bylaw also states that there should be a staff recommendation in here, and there's no staff recommendation in the report. And I do understand it's a political thing, but, I mean, I'm pretty sure there is supposed to be a staff recommendation in any report that moves on. So can anybody, Chair, are you able to speak to that?
No, I'll give it a stab, but I think the recommendation from what I'm hearing from Eleanor is that we don't have staff dedicated towards supporting any kind of professional opinion or recommendation or judgment that we should be following. So, I mean, we could include it there as we move forward. But again, we're deferring it right now, so I don't really think there would be a staff recommendation that would come out of it. Correct me if I'm wrong, Eleanor?
There has to be a staff recommendation for every report. That's stated, that's the rules, as far as I understand.
I just have to pull up that part of the procedural bylaw. Do you have what number it is, Deputy Mayor?
Unfortunately, I don't, I'm not that good. I just know, yeah.
I know it has to come with a recommendation, but I can't recall off the top of my head if it's, committee recommendation or staff recommendation? So let me just see here.
And from my memory, I thought it would be, it's a staff recommendation because you're the experts. Then if ours is differing, then that little box at the bottom would state if our recommendation is different than yours.
Just give me 2 seconds to pull it up. Agenda. It's funny how you can never find these things when you have to in the moment. 20? Thank you, Dan. Oh, I see. The staff report and recommendation received from the appropriate standing committee. Well, I mean, we can add the recommendation. I've verbally told you today, like, what we can do. So we can add that to the report after, and that can be what goes through to council. And then at the bottom, saying that committee's recommending that it be deferred. The challenge is when it's a councillor notice of motion. And it's a chicken egg kind of thing for us sometimes, because there is no action for staff to take unless council adopts that motion
Right.
for us to take action in that area.
Right.
So we're not going to expend a ton of resources, but we could definitely just, the
So I
recommendation
think the idea
here-
of the notice of motion is to get it out for debate and consumption.
Yeah, and the recommendation comes from the elected official themselves versus from the staff members. In previous experiences, sometimes with notice of motions, staff would provide an excerpt in there if it was something that we had background on. But ultimately, the recommendation is coming from the elected official who's saying, approve my motion. But yeah, we could definitely put the staff impact in there and say that it's not something that administration would take a position on at this point. Just because we don't have, like I said, the expertise to say that certain part of that motion, whether, safe injection sites and everything else is the way to go or not.
So I'm thinking that we're going to need some clarification on going forward with these various notices of motion, because it's contradictory to what the procedural bylaw says in terms of staff's expertise and staff's recommendation. So if notices of motion are going to be handled differently, then we probably should get a clear kind of process on how we do that, so that we don't go back to these discussions of, once again, where's staff's recommendation?
Yeah, I mean, it's tricky. Like, technically, yes, this is a staff report. Like, Chantel assisted the elected official in terms of creating the report, but the hang up there is where it says staff recommendation. So maybe when we come back to the procedural bylaw, we'll look at what that wording is to make it better. Yeah.
Just another item to add on, Deputy.
Yeah. Good catch.
Yeah, it's a good question. All right, next item. The aforementioned Task Force Islanders Complex Issues. Eleanor, are you taking this one, really?
Yes, thank you, Chair. So this item is just provided purely for information. The recommendation that goes along with it is that committee receive it as information and same as council. It's just to make council aware that this task force has been created. Along with the report, we've included the terms of reference for how and what the task force is supposed to get up to and who's on this task force. We've heard Carleen Donnelly mention this several times in the meeting so far. So she had created a report for the province, and that report actually was released. So it's been on their website, the province's website, since June 21st, that report has been available. But we thought we'd bring it forward with the rest of this package, so council has it in front of them. And then we also have minutes from the meeting that took place on June 21st, it happened to be. So I will note that the minutes still have draft written on them, but in the meeting yesterday, the task force approved the minutes with no changes. So I've just made that note at the top. I just wanted to be able to get it in this package instead of waiting for the non-draft stamp version to come out. So we're just at the very forefront of this. Early ideas about data collection among the task force group. And the meetings are happening right now once a month.
Starting now. Is there a set date?
Well, they put them in I don't think it's the same day every month, but we do have another one coming up in October and in November as well.
Okay. All right. Comments, questions?
I'm pretty sure too that anybody, it sounds to me like, I know yesterday, His Worship and I attended, we're not members of the task force, but we attended just to observe. So I'm not sure if all council would be able, I assume that anybody could probably go and observe those meetings. Correct me if I'm wrong, Eleanor, or through the chair?
I don't know the answer
In their
to that.
official terms of reference, they don't talk about observers or anything like that. It is the minister who is chairing this. I imagine anybody who was to put forward an email to the minister requesting to attend as an observer, they would consider each person individually.
Okay. Thank you for that, Eleanor. So that'll go on to council as part of the next package, correct? Okay. All right, next item is the report on the bylaw updates.
Thank you, Chair. So we're back with this again, and we had a couple of requests to break the information out last time because we just had a consolidated summary of the results from the surveys from council as well as department heads. So in this particular report, you'll see that it's broken out between council, between department heads, and committees as well. And what we've done in this as well is just taking the information that we had and created a top 10 list, at least to be kicked around by council to decide if this was the list that they wanted to go forward. The other thing I'll note in here, after going back through and having some discussions, we've kind of landed on the capital construction costs or capital construction bylaw and capital cost recovery bylaw as essentially being the same thing. So we've kind of put those together and defined it. And then there was a request on some of these newer bylaws to define what they were as well. The one thing I'll note, and I think we've talked about it in the past, the community standards bylaw would likely see some of the older bylaws being combined into that one bylaw, but we haven't really got to the point of figuring out, working on it enough that we know which bylaws are going to get combined in there. That analysis hasn't happened yet.
So that was a question that I did have. There is no difference between the capital construction bylaw and the capital cost recovery bylaw? They are one and the same?
That's right.
Okay.
Yeah.
Thank you. One other question I had, the zoning bylaw, is that our zoning and development bylaw?
That's
So
correct.
would that not be addressed after our OP gets approved? Is that just put in there, because don't we have to wait till our official plan gets adopted and then do the zoning and development bylaw after that?
No, sometimes what municipalities do is they actually work on both at the same time.
Okay,
So for the zoning and development bylaw, we actually went to RFP to hire a consultant to start that work. So that, I don't think it's come through council yet. If it hasn't come through yet, it's coming through soon. It's got to go through Planning and Heritage Committee first, and then we'll come to council. So we'll have a consultant that will start working on the zoning and development bylaw. And And then we have been planning for the official plan to be wrapped up pretty soon. We had a final draft come through staff yesterday for a final kick at it. So if that wraps up in the coming months, the early work can already start on the zoning bylaw.
Okay, I just have one, thank you for that. I had one other question. With regards to the community standards bylaw, when I looked at the description that you gave, and thank you for supplying that as well too, would the unsightly premises, dangerous, hazardous, and unsightly would that not fall under the community standards when you're talking about like property maintenance and, you know, even environmental concerns would stem from some properties as well too? Like, would that be one that would be absorbed under, because right here it's listed kind of as almost three in one, the dangerous, hazardous, and unsightly premises bylaw, nuisance bylaw, and community standards bylaw. So are we looking at melding those in, like those two would fall under that and then possibly others?
Yes, that's correct. Yeah.
Okay, and as part of that work, we'd figure out what other ones would be absorbed under it as well, or make sense to put under a community standards
That's right.
bylaw. Like, would something like maybe cosmetic pesticides fall under that? Or would,
It depends how long that other bylaw is. There's another one we have somewhere in here for monuments. There's a monument bylaw in here. That's potentially one that you could fold under the community standards in terms of what's in there. It's a very small bylaw.
Okay.
So, I mean, and there's another one we have for smoke-free places. That's another potential candidate maybe that could get folded under community standards.
so that could go back to what, like, previous notion that Councillor McKinnon made with
That's right.
drug usage in public parks and stuff like that could be swept in under at that time as well.
That's right.
Okay, well, that makes sense. All right. So I guess we just need a recommendation or a motion to approve the, and thank you for breaking it down the way it did, Eleanor. It looked like there were some commonalities there were some, maybe a few minor differences, but does anyone, can I get a motion on the floor to approve, or is there any
So
comments?
are we moving on page 34, the 1 to 10 from administration's recommendation?
That's what,
Then I
that's,
move.
yeah.
I move it.
So moved by His Worship, seconded by Councillor
Questions
McKinnon.
on the floor?
Questions on the floor,
Yeah, so
discussion on the floor.
On the dangerous, hazardous, and unsightly premises, we've already discovered, that for the enforcement bylaw, the summary offense ticketing bylaw, these changes have to be made to allow our police service, protection services to give a fine instead of coming back here,
Yep.
correct?
That's my
Correct?
understanding.
That should be done immediately? Because are we going to continue to have properties unsightly, dangerous, hazardous property issues coming to this floor to get voted on, so that month or 6 weeks later, we're following up on it? And I would say also the same for the zoning development bylaw. I think there'll have to be changes to that bylaw to allow our bylaw enforcement officer or bylaw enforcement officers to ticket on site, on scene, and that's not the case right now. It should be part of the revamping of these bylaws.
So you're recommending within our prioritized list that we super prioritize number 1 and number 5?
Well, maybe there are other bylaws where we have to change the bylaw to allow our summary offense ticketing bylaw to be enforceable. I didn't know that was the case until we had, 10 properties or 6 properties, and we had to go through council again? Like, that was the purpose of finally, and the deputy mayor knows, 4 years we were asking for that summary offense ticketing bylaw. Now we finally have it in place.
Yeah.
So I want to make sure that any bylaw that is enforceable through the summary offense ticketing bylaw, the changes are made in those bylaws to make it enforceable.
So what you're asking then is to prioritize these bylaws that directly are correlated with our summary offense
Exactly.
ticketing bylaw,
Exactly.
okay? Because I think, we would all share that concern about the
Yes.
dangerous, hazardous, and unsightly properties. We talked about it ad nauseum. And we've talked at length about empowering our bylaw officers to be able to do their job more quickly and more efficiently.
Yeah.
Is that doable, Eleanor, from,
Yeah, to me, that's a next natural
Next
step,
natural step.
from summary offense ticket. And the goal is with the community standards is trying to get those things into one place that actually would get ticketed.
Right.
So it's easier for everyone, so you're not having to go through
Through a
30
whole
different
bunch of-
bylaws
yep.
looking to see what you might be
Yep.
in trouble with. It's in one place.
Yep, no, it makes sense.
Yeah.
So just a point of clarification, Mr. Chair. So any bylaws that we change, anything that we change in our zoning development bylaw does require public consultation. So if we're changing our bylaws to incorporate them or put them in a package that belongs to community services or community goals, does that require a public consultation, or is that something we can do internally?
Usually when you do something like a community standards bylaw, you do have a public process to go along with it.
I would say.
Because it impacts people and it's an education opportunity as well to work through it with the community. So you have a top 10 list here, but it's different departments that'll be working on it, right? Like, so planning and development are going to be working on the zoning bylaw and that will be their thing.
Yeah,
We're just in the midst, process right now of, why can't I think of their title? Hiring our new,
Strategic initiatives.
thank you, our strategic initiatives person. That person, their first thing on their list would be number one on this list. So, they would be working on that and moving that. So there'll be different people, like, even though there's a list of 10 here, it's not like, okay, well, we have to finish one
Yeah.
and then we'll move on to two.
Yeah.
It's gonna be moving in different parts of the organization.
yeah. Okay,
Chair?
go ahead, Deputy.
I thought the next step after this was breaking down the bylaws and them all going to the respective committees to do that committee work. I thought that's what we decided in our last SPIC meeting, was that once council saw the breakdowns, but we had to come back here because we didn't have the council's breakdown, we just had the overall one that combined everybody. And then I thought we were then taking the bylaws back to each committee, and each committee was going to do their committee work by prioritizing what fell under those various departments within that committee to prioritize. I don't know, maybe I'm wrong, but that's what I thought.
Or page 38, I have.
So
Yeah,
that
that-
was discussed last time, but from our perspective, you still want a recommendation from us, right? So that's the top 10 list. Now, we can take that to each committee if you still wish to go that route, or just take it right through to council. It's up to you.
Well, personally speaking, from this committee, I think the procedural bylaw and the council code of conduct bylaw, we've talked about those requiring some changes, so I think those would be the two priorities from this committee. I think you are right, Deputy. I think we had consensus at our fire and emergency protective services that the dangerous and unsightly premises bylaw had to be tackled. I think when I looked at the survey results broken down, I think there was enough, there might have been a little bit of a discrepancy going on between, but not a great deal. And personally, I'd rather get at this and get moving on it as opposed to taking it back. I think we can eventually get at other committees, but I don't want to bog down this process any further than we already have. And I would like to recommend that we just move along with the administration's recommendation, start tackling those and get moving along with it. And then if we have to if we feel a need at some point in time to direct administration to work on a different bylaw, then we can do so at that time. That'd be my thoughts. Danny wanted to have something to say there too.
Yeah, through the chair to Deputy Mayor, because you're dealing with only one administrative focus on all of this work, each committee would have a different ranking of priorities. So really, but you need to give clarity to all of administration, which are the top, 1, 2, 3, 4, 5. So I think if there are changes to be made in that priority list, you really need to have everybody in the room so you can have an informed discussion, to move one up or down and to go back to committee. You've really done the consultation from an individual councillor's perspective, so you've already compiled all of the wish lists, and then now you collectively have to make the decision. So I think to go back to committee would to support what you're saying is really just bog it down further, that you get in the room and battle it out if there's a change to be made.
And just for clarification, Chair, so that would mean that if we do recommend staff's recommendation of these top 10 prioritized bylaws to work on over the next 12 months, as the bylaws are completed, they will still filter through committee, the appropriate committee, before they move on to council? Would that still not be the case?
I would think that would have to be the case. I mean, it wouldn't be that they would just be done, then it goes back, and then the committee ultimately gives the stamp of approval, and then would take that forth to council. So I think we're just saying get at the work at this point.
That's right.
Yeah,
Yeah, and
go ahead. This is your last question, to your worship.
You want to vote on this? I want to vote on. Is it 12 months? Is that what you just said?
That's,
Yeah, that's,
Yeah.
okay. I just want to get it for the public record, 12 months.
so
Okay.
for this year, this is going to be the focus. These. Question? All those in favor? 3-0. Okay. So now I have to move on to thank you for that, Eleanor, and putting that information together and breaking it down as requested. So I need a motion to move into a closed session as per section 119.1 of the 119.1A of the Municipal Government Act of PEI. Commercial information which, if disclosed, would likely be prejudicial to the municipality or parties involved. Confederation Center of the Arts. Motion? Moved by Deputy or Councillor McKinnon, seconded by His Worship. All those in favor? Okay, we are now moving into All right, welcome back to the live portion. So our discussion will continue at council at a further closed session. Motion to adjourn. Moved by His Worship, seconded by the Deputy. All those in favor? All right, thank you. Have a great day. Thanks for